Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. The VA's proposal to automate. I am going to share this with you. I found this on ABC 12 News, and I wanted to share it with you now. This just came out and was updated on March 29th, 2025. I'm sharing it with you here today. Please hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. Every thumbs up, every minute watched really does help the channel spread its reach, and that's really what we're trying to do. Look, many hands make light work, and together we can inform each other of the changes that are happening at the VA, proposals of changes, and different aspects that we could expect that could impact us or our loved ones or others that are having to work with the VA. So I appreciate it. If you want to support the channel in other ways, consider being a member. Thank you so much to all you members. I really do appreciate your support so very much. I do my best to get back to you in the comments. All right, so let's jump into it here. The headline is Proposal to Automate VA Call Centers, Part of Layoff Plan, sources say. So this opens up the idea that we could potentially be seeing a lot of automation in different realms as well, not just the call center. Could see some automation in claims. We could see automation in scheduling. We could see automation in a lot of different ways and aspects. Good or bad, it's hard to say. I kind of like calling and getting a person on the phone myself instead of pushing a bunch of buttons. So anyway, let's move on. The call centers that America's military veterans rely on are scheduled to schedule appointments and arrange medical care may no longer have a live voice on the other end of the line because the agents who handle the calls are set to be laid off, according to multiple sources familiar with the plans for cutbacks at the Department of Veterans Affairs. Under the proposal, sources said the agency would move to automation, reducing the need for live agents. Love to get your thoughts on this. Put your thoughts in. Do you care whether or not you get a live person on the phone to schedule your appointment? I guess it depends on how easy it is for me. I mean, if it's like, press 1 if this date and time work for you. Beep, 1, I'm done. Cool, that works. But if it's cumbersome, no way. It's not going to work for me personally. All right, let's move on. President Donald Trump ordered mass layoffs across the federal government in February, telling agency heads in an executive action to submit their proposals to the Office of Management and Budget. And the goal was, somewhere between 20 to 25% for the VA. That equated to 80,000 employees. That is the goal, according to the VA secretary. Will they hit that goal? They don't know, but that is the target number. While many of those agency proposals remain under wraps, Veterans Affairs Secretary Doug Collins acknowledged in an interview with Fox News earlier this month that laying off 80,000 VA employees was a goal. It's their target. Such a reduction would represent nearly 20% of the VA's workforce. About 2,400 employees at the department have already been fired. There was also the rehiring of some, and I don't know what the net number is now. The layoff plan at the VA would also affect medical and healthcare support staff, administrative roles, including HR personnel, and regional and central office staff, including those in strategic planning and procurement, according to sources in the agency and on Capitol Hill. The VA also is working with the Department of Government Efficiency to cut costs and identify contracts to cancel. VA Press Secretary Peter, with a hard-to-say last name, said they are aiming to fix major problems at the agency, and he stressed that no final decisions have been made. As part of this process, we've asked career subject matter expert employees and senior executives for recommendations on how to improve care and benefits for veterans without cutting care and benefits for veterans, he said in a statement. The end result of our reforms will be maintaining and expanding VA's mission essential jobs like doctors, nurses, and claims processors, while phasing out non-mission essential roles like interior designers and DEI officers. Following publication of this story, the press secretary for the VA said layoffs, or the press representative, Peter said the layoff plan as described by sources amounted to disinformation and faulted CNN for creating unwarranted fears by reporting on it. This story is based on deliberately leaked false information that does not reflect VA's reform plan, which is still being developed, Peter said in a statement. The fact is almost everything in this story is false. A Democratic congressional staffer who had been briefed by multiple VA officials called the layoff plan for the call centers heartless and dangerous. Veterans in need of life-saving care and compassion should be met with a person who understands their needs and can provide them with information and resources they seek, not a lifeless machine, the staffer added. The staffer also noted that the veteran population in the U.S. is comprised of many disabled and elderly people who may be discouraged from reaching out for help without a live person on the other end of the line at VA call centers. Democrats have seized on the planned layoffs at the VA and any impact on services for veterans who often enjoy widespread bipartisan support. On Capitol Hill, Senator Blumenthal is planning a series of so-called shadow hearings or unofficial hearings held by the minority party on VA cuts starting next week. Blumenthal, the ranking member of the Veterans Affairs Committee, took to the Senate floor Wednesday to decry real-life impacts to our nation's heroes. The Connecticut Democrat said, "I disagree, and it's shameful." According to Secretary Collins, the VA has 4 employees who act as liaisons to DOGE, which have been at the center of Elon Musk's led effort to reduce the size of the federal government. They are working to streamline operations, improve management, and are also examining contracts, Collins wrote in a letter this week to Blumenthal. Blumenthal has raised concerns about DOGE gaining access to federal databases and systems and the vulnerability of veterans' health records and other private information. Collins responded that the VA is committed to safeguarding veterans' data. To be very clear, DOGE does not have access to veterans' personnel records, Collins wrote. In recent weeks, VA, along with DOGE, have moved to cancel hundreds of contracts though some have been put under review for possible reinstatement, according to congressional sources familiar with those efforts. Veterans advocates also have questions about the impact of changes at VA. We've expressed our concerns with the potential RIF, which is reduction in force, both publicly and directly with VA. We're now anticipating official word from VA on what it determines through its assessment and look forward to a plan that ensures VA can continue to deliver timely care and benefits. Randy K. Law, Senior Director of Marketing Communications for Veterans of Foreign Wars, said in a statement, adding VFW members and veterans all agree there are places where VA needs to be more efficient. Among the medical and health care aspects and support, staff targeted for layoffs at the VA are non-patient facing administrative roles. So at the medical and healthcare support staff that are targeted, they are non-patient facing roles. Contract positions in VA medical centers and certain research positions, those congressional sources have said. Staffers on Capitol Hill who have been in contact with the VA employees said that the agency has already terminated some supply clerks at VA medical facilities. These are people who, among their other duties, handle restocking of surgical supplies for operating rooms. Their departure increases the burden on nurses and other staff to handle those duties, they said. The layoff plan, as described by sources, also include a large scaling back of Veterans Integrated Service Networks, that's the VISNs, which I think there's 18 VISNs in the it's kind of like regions or districts, right? So it's the United States is set up into different kind of sections, and those are the VISNs within the healthcare system. These are smaller regional VA offices that provide oversight of the VA's medical facilities across the country and handle telehealth support and call centers. The VA employees being targeted for layoffs in administrative and support roles could include medical appointment schedulers, billing specialists, policy and program analysis analysts, and human resources personnel, sources said. They point out that the VA human resources offices had already been severely understaffed for many years and were just starting to build back up. This is exceptionally short-sighted, one congressional staffer said. Not only does HR assist with hiring staff, but it also proposes processing firing, demotion, promotion, and disciplinary actions, assisting employees with benefits and retirement, and more. The layoffs will come in waves over the next few months, the sources say. Specific employees at risk of being fired will start being identified in April, which we're in now, and May of 2025. Impacted employees will be notified in June. The first round of layoffs will begin in July, and a second round will begin in September. Assessments will be taken after each round to evaluate disruptions. Some affected employees will transition into new roles, and the department plans to help some affected workers seek other federal employment. So there's a lot going on. Love to get your thoughts. Thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.